So hi guys and welcome to this session. So in this session we'll be discussing about pneumonia, right? So what do you mean by the pneumonia? Pneumonia is basically is present of fluid in the alveoli, right? So what do we all know alveoli is the site of gaseous exchange. In some conditions fluid or pus is also present in the alveoli, that is known as empyema, right? So this is about pneumonia. So let's see what actually happens in this pneumonia is whenever this pneumococcal bacteria it entered into lungs and it will get moved to the alveoli, right? When they will move to the alveoli, that we all know that lungs is also having some security mechanism that are alveolar macrophages. This alveolar macrophages, they will try to destroy the pneumococcal bacteria or pneumococcus, and there will be certain changes in the lungs. So let's discuss what are all the changes or pathology in the lungs, right? So let's discuss about pathological aspect of pneumonia. So what actually happens, how the disease will get progress, pathology of the pneumonia. Suppose we all know pneumococcal bacteria is entering into the human body. After entering this human body, pneumococcal bacteria, what these lungs will do, right? There will be a release of neutrophils and RBCs, they will get accumulated or they will get surrounded within the lungs, and this stage is known as red hepatization. So what do you mean by this red hepatization? Why I'm mentioning this red hepatization is the lung is surrounded by the RBC, and if you take normally the lung is spongy in nature, and when you look at this in this condition the lung will become bit solid, right? So and the texture of the lung will remains as a texture of the liver, so that's why it is an hepatization. And next stage what will be happen is this RBCs they will undergo the lysis, so that is known as gray hepatization. Okay, so still the texture of the lung is similar to the texture of the liver, so that's why I mentioned this gray hepatization over here. And this is the stage where you will get the signs and symptoms, right? So whenever the bacteria will enters into the human body, after couple of the days you will get these signs and symptoms. So in which phase it will occur or in which stage is gray hepatization, and last stage is your resolution stage, right? So what will happen in this resolution stage is there is a fight between good and bad. So whenever there is a fight between good and bad, definitely good will win, right? So same condition it happens in the lungs also. Like this alveolar macrophages, they will try to destroy the bacteria, and this dead debris of neutrophils, right? Neutrophils, some of the neutrophils they will get die and they will get converted into the pus, right? Pus. So that is the characteristic feature how pus is formed in the alveoli, right? So neutrophils they will get die and the dead debris of the neutrophils they are converted into the pus. So these are all the stages. So let's discuss about the stages, and let's alveolar edema, red hepatization. Alveolar edema, we all know what will happen in this stage is exudate is formed in the alveoli. Okay, exudate is formed in the alveoli. In red hepatization what will be happen is there will be a neutrophils will come into the action, and RBCs also they will get surrounded in the lungs, right? And in gray hepatization what will be happen is these RBCs they will undergo the lysis, right? Breakdown of the RBCs will happen, and this is the stage where you will get the signs and symptoms. Signs and symptoms will occur in this stage, right? And there will be a release of fibrin also. And next stage is your resolution phase. So what do you mean by this resolution phase is the security system in the lungs such as alveolar macrophages. If you go to the liver is having their own security system that is known as Kupffer cells, right? So like this alveolar macrophages, they will destroy the bacteria. They will not only destroy the bacteria, and this some neutrophils will also get lost. Some neutrophils will also get lost. So this leads to the formation of debris, right? So as a result, pus is formed in this. So these are all the stages of pneumonia. Okay. And now let's see this chest X-ray, very important, and these are all the radiological features. So what are all the radiological features you may see here? Here is, look at this right side of this lung, right? If you look at this part, there is an opacity is present only in this part, and in upper part there is no opacity, and this lower part also there is no opacity. Only this region is opaced. So look at the X-ray carefully, and here the opacity is in the form of an horizontal fissure, right? And it is not present in the upper part, right? So if same opacity, if it is present in this upper part, which I have mentioned over here, is like, so that leads to the condition called as your lung got collapsed. So the opacity it is present over in this horizontal fissure. So that's why this is the characteristic feature of pneumonia lung, which is also known as consolidation, right? So what do you mean? Basically the consolidation is like this, opacity is present in the horizontal fissure, not above, right? So this is a characteristic feature between the pneumonia and lung collapse. Okay. And now look at this diagram carefully, or this radiological, this is an HRCT of the lung. And if you look at these, alveoli are completely white and bronchioles are completely black, right? So what this condition is known as, more opaque. Alveoli is more opaque, right? So presence of a fluid, whenever there is a fluid is present, there you can see a whiteness in the lung, right? So this is a characteristic feature of pneumonia lung. So this feature is known as air bronchogram. This is air bronchogram. So what do you mean by this air bronchogram? Is nothing but if you do the HRCT of the lung, bronchioles will get black here. And what about the alveoli? It is completely white, right? So look at this. This is completely whiteness. So this is about radiological features, very important, right? So and now let's discuss some of, we have discussed stages also, and now let's discuss some what are all the causes of an community acquired pneumonia and all, very important one liners they may ask you. So if they ask like what is the most common cause of community acquired pneumonia is, you can go with these options, right, such as pneumococcus pneumonia, pneumococcus, or you may put like streptococcus, both are same. And next, if this is not present in your option, you can go to mycoplasma, right? Mycoplasm, okay? Mycoplasm. So we all know like mycoplasm is an atypical organism, right? So this is an atypical organism in the sense they don't have cell wall. Cell wall is absent in this. Okay, this is all the common causes of community acquired pneumonia. If they ask you what is the causes in the AIDS patient, what is the most common cause of pneumonia, that is pneumocystis zerovenci. Okay, and what is the most common in alcoholic, they ask, you go for Klebsiella. Okay, Klebsiella is the most common cause. And next in ventilator associated pneumonia, Pseudomonas aeruginosa, right? Pseudomonas. Pseudomonas aeruginosa is the most common cause in ventilator associated pneumonia. In hospital acquired pneumonia, very important, this is staph aureus, right? So what is the criteria to diagnose whether hospital acquired pneumonia, or it is also called as nosocomial? That is, it should be greater than 48 hours, right? Suppose imagine a patient has admitted for an elective surgeries, whether it may be whatever surgery, it may be, imagine like an laparoscopic cholecystectomy, and the patient has developed pneumonia and he has admitted yesterday. So we cannot call that as an hospital acquired pneumonia, and the criteria it should match, it should be greater than 48 hours. Okay, and these are all the causes, and you may get the one liners also. So please go through this slide once before going to the exam. And next we move on to the nursing assessment. What are all the nursing assessment you will find? So definitely pneumonia is a bacteria. Whenever there is a bacterial infections, we will get the fever. And I taught you that alveoli is the site of a gaseous exchange. So gaseous exchange is not happening properly. There will be a development of SOB, shortness of breath. Okay. And next is on like you may get the chest pain in this patient. Okay, chest pain is nothing. Why? Because these bacteria, they will irritate the pleura, right? They will, whenever they will irritate the pleura, you will get the chest pain. So this is the cause for the chest pain. And one more important characteristic feature is, if you look the sputum of this patient, right, you will get the rusty sputum. And one more point I would like to add is, this is especially found in the person who is taking an alcohol and he got infected with an Klebsiella. So what kind of sputum you are going to see is red, currant, jelly, sputum, not stool. I am not talking about intussusception, which is a pediatric condition. There we will find a red currant jelly like stools. Here it is, I am speaking about sputum. Red currant jelly sputum is found in pneumonia, and especially in which patients? Those who are consuming the alcohol, right? So these are all the nursing assessment you should know before going to the exam. And shortness of breath is nothing but, generally most of the people, they will be using the sternocleidomastoid muscles, right? So for these are all known as accessory muscles of respiration. So these are used when the person is walking through an upstairs with a very huge bags. They are taking huge bags, and when you are going for trekking and all, right, you will be carrying that huge bags. In such conditions, most of the people, they will be using these sternocleidomastoid muscles. And but these persons, due to difficulty in breathing, and they will be using in the normal condition also, right? And this is about nursing assessments. On examination, what you are going to find is respiratory rate is already increased in this person. And what about tactile firmness, whether it is increased or decreased? Yes, it is increased. Why? Because whenever I am speaking low, not only speaking, not only in me, like in a normal person, if you speak like there will be some vibrations in the lung. But due to this solidification, due to this, I told you, bacteria will cause the lung becomes too solid. Due to this solidification, the conduction will become very fast, and the sound will increases in a very high pitch, right? So this is tactile fermenters will also get increased, and whispering, right? So what do you mean by this whispering is, I thought you now only know that whenever if you take this deep breath and all, and in normally in that you and me, the conduction is very slow, but in this patient the lung is solid. Solids are very good conductors, right? So that's why if you look at the lung sounds, it is too fast in this condition, and you will heard it in a very high pitch. And next very important point, like what about the air entry in this patient? So I will mention in different color. Air entry, whether it is increased or decreased, or it is normal. Yes. So most of the students in offline and all, like they used to answer like air entry is decreased. Remember, the problem is not in the lung, the problem is in the alveoli. Look at this. I thought you in the definition itself, fluid is present in the alveoli, not inside the lungs. So air can enter easily, but not like in the COPD and all. If you take this chronic obstructive pulmonary disorders and all, if you look the terminal bronchioles, respiratory bronchioles, they will be like this dilated. Air trapping or air wasting will occur here. But in pneumonia, you won't see such kind of blebs or bullas or air wasting. Lungs are completely fine, but the problem is in the alveolus. So that's why air entry is normal in this condition. Okay. So not increase, don't answer it as no increase or decrease. So air entry is normal. What about percussion? On percussion, what you will find? And one more point, very important topic. So what is the breathing pattern in the pneumonia? Yes. So what kind of breathing pattern we can see? Breathing pattern. So let me teach you first normal condition. So in you and me, if we breathe, inspiration, imagine this is I am inspiring, and next I am expiring, right? And there is no gap between inspiration and expiration. But in pneumonia patients, there is inspiration and expiration. So look at the diagram carefully. In normal person there is no gap is present between inspiration and expiration, so this is called as vesicular breathing. This is normal, okay. But in pneumonia patient, what is the breathing pattern you are going to see is bronchial breathing. So what do you mean by this bronchial breathing? Means between inspiration and expiration there is an audible gap is present, okay. So this is about bronchial breathing, which is very very important and characteristic and especially seen in pneumonia, okay. And this is about lung this respirate on examination. And one more point I would like to add is like on percussion what you are going to see, like dull percussion note is seen over here, right. And this is about examination finding and nursing assessment. So very important point is like which I have highlighted, these two are very important, like air entry and breathing pattern you should know before going to the exam. And next we move to the curve 65 score. This curve 65 score, it is why it is used. So what are all the components that will come in this and all, right. This is written like this score is basically used to know whether the patient is required hospitalization or the treatment it is done on OPD basis or IPD or in an ICU basis, right. So in curve 65, and one more point in here is like egophony. So what do you mean by the egophony is, if you tell the patient to tell E, the patient will pronounce it as A, right. So this is about egophony, but this is seen in other disease, lung disease condition also. And what about this curve 65? In this curve 65, what does this C stands for? Confusion, okay. And confusion is nothing but altered mental state. So how much should be? It should be less than 8. And what do this U stands for? Blood urea nitrogen. So how much should be? It should be greater than 7 millimoles per liter. And R stands for respiratory rate. Your respiratory rate should be greater than 30 beats per minute, okay. And what about this? B stands for BP is less than 90 by 60 mm of Hg. If the patient BP is less than 90 by 60 mm of an Hg, what does it specially indicates is the patient is going to septic shock. And what about age? Should be greater than or equal to 65. For everything I will be giving score 1 1 1 1. If it is present 1 1, I will be giving the score 1 1 1, right. And my curve 65 score, so what nowadays this U is not been used, this blood urea nitrogen is not been used because like in the sense like it is been used in most of the hospitals. But the what is the disadvantage of this U is, U term is like if you know want to know this blood urea nitrogen level, it may the lab reports, it may come, it cannot come immediately, right. Respiratory I can do it immediately, confusion I can do it immediately, BP this and all are like within the seconds we can take all this. Like if you take these bun values, it will require 1 to 2 hours to come the report. So that's why like they are not using nowadays. And I told you curve 60 and your curve 65 score is 0. So what does it indicates? Everything is fine and you can treat the patient on OPD basis, out patient basis, right. And what about if the curve 65 score is 1 to 2, you are treating in inpatient basis. And what about it is greater than or equal to 2, it is in the ICU basis. So this is about curve 65 and treatment. And let me write mortality rate over here. So if the score is 0, the mortality rate is very less, 1.2%. And here it is like 9.2%, and here it is like 22.2 or 22%, okay. This is about mortality rate in this curve 65 according to curve 60. And now very important is treatment, and how you are gonna treat the patient is very important, no? So if your patient is OPD basis, so what is the score? Score is 0. And if the patient is having no comorbidities, no comorbidities is present, you are going to treat with AMD. So what do you mean by this? A stands for Let me write it clearly. You are going to treat in the A, M, D. A stands for amoxicillin. M stands for macrolides. Macrolides. And D stands for doxycycline. Okay, these are all the treatment if the patient is having no comorbidities. And if my patient is having comorbidities are nothing but if there is an DM or like the patient may be suffering from any coronary artery disease and heart diseases and all, and this treatment is same for this patient also. So like amoxicillin, so it, remember I am teaching for the score 0, that is on OPD basis. Amoxicillin. And same AMD is same for here. AMD is the mnemonic you are going to remember over here, and M stands for macrolides, and D stands for your doxycycline plus amoxiclav plus clavulonic acid. Lonic acid. So which is your augmentin. And now if everything is not done, then I will be using this respiratory fluoroquinolines such as moxiflox, levoflox, right? These are all your respiratory fluoroquinolines. And this is about treatment basis of OPD basis. And now I move to this IPD inpatient, right? So what is the difference between IPD and in ICU basis is like this patient they do not require ventilator support, and if you go for the ICU patient they may require the ventilator support. Okay, and if there is non-severe case, so what do you mean by this non-severe? Is nothing but if the patient is all is curve 65 is normal and the patient is oriented and Bun value is elevated and there is no DM or any coronary artery diseases and all, so then this comes under non-severe condition. So in non-severe condition, so what are all these stands? RBM is the mnemonic. R stands for respiratory moxiflox levoflox, respiratory fluoroquinoline, and B stands for your beta lactam, and M stands for macrolides, right? And in case of severe, same beta lactam so you should give, or beta lactam. I may use macrolides or I may add respiratory fluoroquinolines over here. Okay, and this is about treatment aspect on IPD basis, not on OPD. OPD so AMD is the mnemonic for OPD, amoxicillin and macrolides and doxycycline. In hospital or in ventilator associated pneumonia, we all know like in ICU patients will suffer from this. So what is the major cause for this? Like using the same tubings without proper cleaning or without proper sterilization of the same tubings. If you are going keep on using to the multiple patients, like we will be seeing in the most of the hospitals they will be using in the multiple for multiple patients due to the less available of the resources. So that leads to the ventilator associated pneumonia. And very important, the tubing should be very clean and you should maintain all the sterile procedures over there. And if you look into this, like what are all the treatment for no risk is, like here definitely I should give piptas for this patient, piperacillin plus tazobactam, so which is commonly known as piptas, right? And if there is a risk factor present like confusion is present and like DM or something is present, like then I should go with this, right? And here remember like this I will give in non-severe IV is given in inpatient basis. And here what I am going to do is like here also I will be using these piptas. Piptas I should give in Vapcare pneumonia. Piptas is the best, right? Piptas I should give, and I may add amikacin to this, or I may add respiratory fluoroquinones such as levoflox, moxiflox to this, right? And this is about treatment aspect in hospital. Piptas is the drug which you should give. And If they ask you what is the drug you are going to use for MRSA, methicillin resistant staph aureus, right? So what you are going to use is linezolid. Linezolid is used in MRSA, right? And this is about all the treatment aspect and lung x-ray and on examination, nursing assessment, causes, and please go through this slide before going to the exam, and please go through the chest x-ray carefully. And this is all about disease aspects of the pneumonia, what are all the causes and what are all the stages in the pneumonia, and VAP pneumonia, and their treatment aspect is very important. And we'll discuss pediatric pneumonia in our pediatric sessions. It is also a very important topic, and this is about medicine related aspects. So thank you for hearing, guys, and keep studying.